I was doing my training in 2022. I met this guy. He came to the hospital to do medical tests almost every week. There was no week that passed by that you wouldn't see this guy in the hospital, whether it's a leg pain, whether it's a backache, maybe he's running temperature or he's vomiting, a lot of things. And I was like, what exactly is going on? Why is this guy always visiting the hospital? Until they told me that he has hemoglobin SS. That means he is a sickler with an SS genotype. I couldn't wrap my head around it for a minute. Hello guys, welcome to my YouTube channel. My name is Patrick. I'm a medical laboratory scientist in Nigeria, Africa precisely. So I talk about things ranging from health talks and general ideas about your health. If you're new to this channel, thank you for coming to check me out, and if you're a returning subscriber, thank you for coming back. In this video today, I'll be talking about sickle cell disease. It's a lot. I've seen people struggle with sickle cell disease over time and nobody is talking about it. I really don't know why people were born to suffer in this planet Earth. Life is short, right? But we must not live life suffering the rest of it. What is sickle cell disease? Sickle cell disease is when there is an abnormality in the gene that codes for a particular hemoglobin. When that hemoglobin has a mutation or has undergone mutation, the genes that would have probably coded for a normal hemoglobin, which is AA, is now giving you an SS. In that case, the person either has a disease or has a trait. The trait is when the person is AS and the disease is when the person is SS. In that case, the person's hemoglobins now sickles. Normally, the red blood cells is bicconcave in nature and kind of round, but in this case of sickle cell people, they do not have those red blood cells that are round. They have the ones that are like C-shaped. They call them a sickle shape. We got it from an equipment we use called SICKLE. The blood is now sickle in shape, making it difficult to pass through those blood vessels. That is why those people experience pain all the time, crises all the time, and that is why they always pay regular visit, because their blood dies faster. Normally, red blood cell takes about 120 days to die, but theirs takes less. They always are short of blood. They are always short of blood. They always need to get to the hospital. They always need blood transfusion. They are always in pains. Sickle cell disease is a lot, and for people suffering with sickle cell disease, you could ask questions. You will notice that they are not living a normal life the same way you with a normal hemoglobin lives. They are going through a whole lot. How do people even get the sickle cell disease? A child inherits sickle cell disease from his or her parents. When a parent has an hemoglobin AS and gets married to another individual with an hemoglobin AS, so when they come together, they have every tendency to give birth to a child with an SS hemoglobin or SS genotype. What happens when an AA parent now marries an SS parent? In that case, they will definitely reproduce one of their kind. This sickle cell disease is gotten from either both parents or one of the parents. Just like I explained, if one of the parents is AA, the other parent is SS, definitely they will produce an SS child or an SS individual. Or it can also be gotten from both parents when one is AS and the other one is AS. That is sickle cell disease. And we also have what we call sickle cell traits. So those people with AS are carriers of this sickle cell. That means they have tendency of sending it into another generation. Sickle cell disease comes with different symptoms, lifetime-threatening symptoms, ranging from anemia, episodes of pain, unexplained confusion, headaches, vision problems, and also frequent infections because their immune system is compromised and cannot be able to fight infection just the way the normal individual with a normal hemoglobin will fight infection. In complicated cases, sickle cell disease could lead to things like stroke, blindness, leg ulcers, pregnancy complications in pregnancy. So it could lead to various things, and it could also lead to death. Living with sickle cell disease will require that that individual has a regular visit to the hospital, keep up with prescribed medication, not just any medications, prescribed medication from your doctor, either a general practice doctor or an hematology specialist doctor. And one general thing that they can also do is to avoid cold weather. That is why most of the times you always see them on cardigans. How can we completely avoid sickle cell disease? To completely avoid the sickle cell disease to an unborn child, it is medically advised that individuals with sickle cell traits or sickle cell disease should not be a couple. If you found this video helpful, please do share it, give a like, and also subscribe so you get notified when I post new content. I'll see you in my next video. Bye.